Hospitals, emergency rooms across the Mid-South, they are packed with patients. Le Bonheur even had to rent equipment to help with the growing demand. Local 24 News reporter Caitlin McCarthy, she actually went looking for answers tonight, did some digging. What did you find out?
Katina, it's a season of sneezing, sniffling, and spreading germs. And while it seems like there's no room at the inn or the ER, there's a reason.
Right now, we're in the middle of the epidemic that we call the Memphis crud, where we're seeing a lot of sinus, bronchitis, even pneumonia. And we're at the beginning, the cusp of flu season as well.
Dr. Mark Castelaw with Baptist Medical Group says between primary care doctors being booked and people not sure of what their symptoms could be, the ER is packed.
People that usually aren't doctors, they get sick, and so they really don't know. And you can't really criticize anybody about going to the emergency room.
He says it's always better to be safe rather than sorry, because it could be something very serious.
The most common thing is in the cooler weather is coronary disease, chest pain, shortness of breath, coming to see whether they're having a heart attack or not.
Hospitals are having to put patients in hall beds, like this photo taken at Methodist Olive Branch. Dr. Castelaw says it's because there's a set number of rooms in an ER. He adds nurses and doctors get sick too and need time off. But Dr. Castelaw says emergency rooms are just that and are always working to make sure everyone is taken care of.
The overwhelming numbers that the emergency room has to deal with is very difficult. And so it's easy to say be patient, but that's about the only thing. Be a good patient and be patient, and because that's about the only option that you really have.
Dr. Castelaw also wants to remind you that it's still not too late for that flu shot. Live in Bartlett, Caitlin McCarthy, Local 24 News.